Try this before you keep scrolling. Take one normal swallow, then pause for 2 seconds and pay attention to the feeling behind your tongue and high in your throat. Do you feel a layer there, almost like a film? Do you feel the need to cough, clear your throat, sip water, or make that small scraping sound just to feel open again? For many adults past 55, this becomes so familiar that they stop thinking of it as a symptom. It starts quietly. Maybe the throat feels coated only after waking up. Then the morning clearing takes longer. Then certain meals seem to trigger it. Then the voice sounds rough for the first hour of the day. Eventually, a person begins carrying water, avoiding social meals, keeping mints nearby, or assuming this is simply what happens with age. But the body rarely creates a persistent signal without a reason. Thick throat mucus is not just an annoyance. It is often the visible result of something deeper happening in the airway, the stomach, the sinuses, the medication system, hydration status, or even the gut. The mistake many people make is treating the mucus itself while never asking why it keeps being produced. That is why lozenges, cough drops, hot tea, and throat sprays may help for a little while, but the problem returns the next morning. They soothe the surface. They do not always reach the driver. Today, I want to walk you through 5 common and often overlooked reasons older adults develop ongoing mucus in the throat. More importantly, I want you to understand how these causes can overlap. In real life, this problem is rarely one clean, simple thing. A little reflux at night can irritate the throat. Mild sinus drainage can add to it. Dehydration can thicken everything. A medication can keep the throat reactive. Gut inflammation may influence the airway from a distance. When these pieces stack together, the symptom can feel stubborn, confusing, and impossible to solve. But once you understand the pattern, you can take much more precise action. By the end, you should be able to look at your own pattern and say, this sounds more like reflux, or this sounds more like drainage, or this started after a medication change. That clarity matters. It turns a vague daily frustration into a problem you can discuss intelligently with your doctor, pharmacist, or ENT specialist. It also helps you stop wasting time on remedies that only numb the throat for an hour. The goal is not to panic you. The goal is to give you a calm, practical framework for understanding why your throat keeps asking for attention. As you listen, compare each cause with your own timing, triggers, medications, sleep position, meals, water intake, and sinus symptoms. The pattern matters more than any single isolated detail. I am Dr. Richard Kim. Before we dive into the science, please take a brief moment to like this video, subscribe to the channel, and share it with someone you care about. Your continued support allows this channel to grow faster than I ever imagined, and it empowers me to keep producing these in-depth, scientifically grounded health guides for as many people as possible. Thank you so much for being part of this community. Before we name the causes, we need to correct one common misunderstanding. Mucus itself is not the enemy. Your body is supposed to make it. Your nose, throat, sinuses, and airways constantly produce a thin protective layer that traps dust, germs, irritants, and particles before they travel deeper. It keeps delicate tissues moist. It helps defend your lungs. It is part of the cleaning system of the respiratory tract. The problem begins when mucus becomes too thick, too excessive, too irritating, or too slow to clear. Inside your airways are tiny moving structures called cilia. They are microscopic, hair-like sweepers that move mucus upward and out. This process is known as mucociliary clearance. When it works well, you barely notice mucus because it keeps moving. It does its job silently. With age, that clearance system can become less efficient. The cilia may not beat with the same speed or coordination they once did. The airway lining can become more sensitive. The mucus may remain in place longer. That means a small irritant that a younger body might clear quickly can linger in an older adult and create hours of throat clearing. So when someone says, it is just mucus, that is too shallow. In a person over 55, persistent throat mucus often means the production side has increased, the clearing side has slowed, or both are happening at the same time. The first major cause is silent reflux, medically called laryngopharyngeal reflux. This is one of the most important causes because many people never suspect it. When most people hear reflux, they think of heartburn. They imagine burning in the chest, sour burps, or pain after spicy food. Silent reflux can happen without any of that. In silent reflux, stomach contents travel upward high enough to irritate the throat, voice box, or upper airway. The lower valve between the stomach and esophagus is supposed to stay closed after meals. Over time, or because of pressure, weight, late meals, certain foods, alcohol, some medications, or anatomical changes, that valve may not seal perfectly. Small amounts of acid or digestive enzymes can move upward, especially when you lie down. The throat is not designed to tolerate that material. Even tiny exposure can make the tissue respond defensively, and one of the body's simplest defenses is mucus. It coats the irritated area. It tries to protect the surface. So you wake up feeling as if something has collected behind the throat, even though the original problem may have started in the stomach while you were sleeping. This is why morning symptoms matter. If your throat is worst when you first wake up, if your voice is raspy early in the day, if you cough after lying down, if symptoms worsen after late dinners, or if bending forward makes the throat feel more irritated, silent reflux should be on your list. The confusing part is that many people with this pattern do not feel classic heartburn. They may treat themselves for allergies for months. They may drink more tea, use cough drops, or blame cold weather, while the nightly reflux continues. There is also a medication connection worth knowing. Regular use of anti-inflammatory pain relievers, such as ibuprofen or naproxen, can irritate the stomach lining in some people and may worsen reflux tendency. This does not mean everyone must avoid them, and it does not mean you should stop a medication on your own. But if you take them often for joint pain and your throat mucus has become persistent, that is a conversation to have with your clinician. The second major cause is post-nasal drip from chronic sinus or nasal inflammation. This one can be very sneaky. Many people expect sinus trouble to feel dramatic. They expect facial pressure, yellow mucus, blocked nostrils, fever, or a clear infection. But chronic inflammation can be much quieter. The nose and sinuses can produce extra mucus that drains backward instead of forward. It may not flood out of your nose. You may not feel extremely congested. Instead, it trickles down the back wall of the throat throughout the day or overnight. The throat then reacts to that drainage, and you feel the need to clear, cough, swallow, or spit. This can come from allergies, irritants, dust, dry indoor air, pollution, smoke exposure, chronic rhinitis, or age-related changes in nasal lining. In some people, the mucus is thin and watery. In others, especially when hydration is poor, it becomes thick and sticky. One clue is timing. If your throat mucus continues all day, if you feel drainage when you lie flat, if you often sniff or swallow, if your symptoms shift with weather, pollen, dust, or indoor air, then post-nasal drip may be involved. The problem with many over-the-counter approaches is that they dry secretions without reducing the underlying inflammation or clearing the drainage. Some antihistamines can make mucus thicker, especially in older adults, and they can also cause dry mouth, sleepiness, constipation, or urinary difficulty in certain people. That does not make them useless, but it does mean they should be used thoughtfully. One of the simplest supportive strategies is saline nasal irrigation. A properly prepared warm saline rinse can physically wash out mucus, allergens, irritants, and inflammatory debris. It may also help the nasal lining function more normally. The key is correct technique and clean water. Use distilled water, sterile water, or water that has been boiled and then cooled. Do not use plain tap water directly in a rinse bottle or neti pot. Follow the device instructions carefully and clean it after each use. The third cause is medication-related throat irritation, especially from a blood pressure medication class known as ACE inhibitors. These medicines are widely prescribed and can be very useful. They help many people control blood pressure and protect long-term cardiovascular health, but they also have a well-known side effect, a dry cough, throat tickle, or persistent clearing sensation in some users. ACE inhibitors can increase levels of bradykinin and related substances in the body. In certain people, this can make the airway lining more sensitive and irritated. The result may not feel like a typical cough at first. It may feel like a tickle, a scratch, a constant need to clear the throat, or mucus that never seems to move. The important detail is timing. This side effect does not always begin on the first day. It can appear weeks or months after starting the medicine. That delay is why many people never connect the throat problem to the prescription. They may say, I have been on that medication for a long time, so it cannot be the cause. But delayed onset is possible. Common ACE inhibitor names often end in pril, such as lisinopril, enalapril, ramipril, or benazepril. Do not stop these medications suddenly without medical guidance. Blood pressure control matters. But if your throat symptoms began after starting or changing a blood pressure pill, ask your pharmacist or doctor whether it is an ACE inhibitor. In many cases, there are other medication classes, such as ARBs, that may be considered if your clinician agrees. This is one of the most practical points in the entire discussion because no amount of honey, tea, or rinsing will fully solve a medication side effect if the medication remains the driver. You need the right conversation with the right professional. The fourth cause is chronic mild dehydration. This sounds too basic, so many people dismiss it. But the physiology is direct. Mucus is mostly water. When your body and airway surfaces are well hydrated, mucus is more likely to stay thin and mobile. When hydration is low, mucus becomes thicker, stickier, and harder to clear. Think of the difference between a light broth and a thick syrup. Both are liquids, but they move very differently. Your mucus behaves the same way. A throat that already has mild reflux irritation or sinus drainage will feel much worse if the mucus becomes concentrated and glue-like. Aging makes this more relevant because thirst signals often become less reliable. Many older adults do not feel thirsty until they are already behind. Some intentionally drink less to avoid nighttime bathroom trips. Others take diuretics or medications that change fluid balance. Some rely heavily on coffee or tea but forget plain fluids and water-rich foods. The result can be low-grade dehydration that persists day after day. You may not feel dizzy, you may not feel severely dry, but your throat mucus can still thicken. Your mouth may feel sticky, your urine may be darker than usual, your voice may fatigue faster, your throat may feel worse in the morning after many hours without fluids. The answer is not to force extreme water intake. People with heart failure, kidney disease, severe liver disease, or fluid restrictions need personalized advice. But for many adults, a steady hydration routine throughout the day can make mucus easier to clear. Warm water in the morning, soups, herbal teas, fruits, vegetables, and consistent sipping can all contribute. The fifth cause is the gut-airway connection. This is less obvious, but increasingly important. Your digestive system and respiratory system communicate through immune pathways, inflammatory signaling, and the nervous system. The gut microbiome, meaning the community of bacteria and other microbes living in the intestines, can influence how reactive the airways become. When the gut microbiome is balanced and supported, it can help regulate immune tone. When it is disrupted by low-fiber diets, repeated antibiotics, high sugar intake, heavy alcohol use, chronic stress, poor sleep, or illness, the immune system may become more inflammatory. In some people, that inflammation can influence the upper and lower airways, contributing to irritation, mucus production, or sensitivity. This does not mean gut health is the only explanation for throat mucus. It does not mean a probiotic will magically cure the problem. But it does mean that a throat symptom may sometimes be connected to whole-body inflammatory patterns, not just the throat itself. A gut-supportive approach is not complicated. It starts with fiber-rich plant foods such as beans, lentils, oats, vegetables, berries, seeds, and whole grains if you tolerate them. Fermented foods such as plain yogurt with live cultures, kefir, sauerkraut, kimchi, or other traditional fermented vegetables may help some people diversify their diet. The goal is consistency, not perfection. Small daily changes can gradually support a healthier internal environment. Now, here is where the 5 causes become more powerful together. Imagine a person who eats dinner late, lies down soon afterward, and experiences mild silent reflux overnight. That irritates the throat. At the same time, their sinuses are producing a slow drip because of indoor dust or chronic rhinitis. Then, because they drink very little water, that drainage becomes thick. Add an ACE inhibitor that keeps the airway sensitive, and perhaps a low-fiber diet that increases inflammatory tone. That person does not have one problem. They have a stack of small problems pointing to the same symptom. This is why persistent throat mucus often feels so resistant. People treat one piece for 2 days, see only partial improvement, and give up. A more effective approach is to reduce the total burden from several directions. Before we move to the action plan, we need to separate common mucus from warning signs. Most persistent throat mucus is not dangerous, especially when it matches patterns like reflux, post-nasal drip, dryness, or medication irritation. But certain symptoms need medical evaluation. Please contact a healthcare professional promptly if you notice blood and mucus, a new lump in the neck, unexplained weight loss, progressive trouble swallowing, choking, persistent pain on one side, fever that does not resolve, shortness of breath, or a voice change that lasts more than a few weeks without improvement. If you smoke or smoked for many years, persistent throat or voice symptoms deserve extra attention. These signs do not mean the worst is happening, but they should not be ignored or managed only with home remedies. Another useful clue is the quality of the mucus. Reflux-related mucus often feels like a sticky coating or lump sensation without much nasal congestion. Sinus drainage often feels like something is sliding down from above, especially when you lie back or wake up. Dehydration tends to make everything ropey, tacky, and hard to swallow away. Medication irritation may feel more like a tickle than a true wet cough. These clues are not perfect diagnoses, but they help you organize the story instead of describing everything as phlegm. Now let us turn this into a practical plan. Start tonight with reflux control. Finish your last meal at least 3 hours before lying down. This one step reduces pressure on the stomach when you sleep. Avoid large late meals, heavy fried foods, chocolate, peppermint, alcohol, and very spicy or acidic foods in the evening if they worsen your symptoms. You do not need to fear every food. You need to identify your pattern. If morning mucus is a major issue, elevate your upper body during sleep. Extra pillows often bend the neck and may not help enough. A wedge pillow or a slight elevation under the head of the mattress is usually more effective. Gravity matters. When your throat is higher than your stomach, reflux material has a harder time traveling upward. Next, protect the nasal side. Try a daily saline rinse for 2 weeks if post-nasal drip seems likely. Use sterile, distilled, or previously boiled and cooled water. Use the salt packets designed for nasal rinsing or follow safe preparation instructions. The water should be comfortable, not hot. Rinse gently. If you have frequent nosebleeds, severe sinus disease, ear problems, or recent nasal surgery, ask a clinician first. Also look at your environment. Dusty bedrooms, old pillows, dry air, smoke, strong fragrance, mold, and pet dander can keep the nose inflamed. Wash bedding regularly. Consider a simple humidity check if the air feels very dry. Avoid blasting strong scents near your sleeping area. The nose is not separate from the throat. What irritates one can drain into the other. Then review medications. Write down when your throat symptoms started. Write down when each prescription was started or changed. Bring this timeline to your doctor or pharmacist. Ask specifically, am I taking an ACE inhibitor, and could it be contributing to throat clearing or cough? This is a focused, useful question. Again, do not stop blood pressure medicine on your own. The goal is a safe substitution or adjustment only if your clinician thinks it is appropriate. Hydration should become scheduled, not accidental. Begin the morning with warm water before coffee. Keep water visible where you sit. Pair drinking with routines you already do. After brushing your teeth, after taking medication, before each meal, and mid-afternoon. If you wake at night with a dry mouth, discuss mouth breathing, sleep apnea symptoms, medications, and nasal blockage with a professional because nighttime dryness can have several causes. Food can support the gut-airway connection over time. Add one fiber-rich food daily instead of trying to overhaul everything. A bowl of oats, lentil soup, chia seeds, beans with lunch, vegetables at dinner, or berries with plain yogurt are simple options. If fermented foods suit your digestion, use small portions. If they trigger bloating, reflux, histamine-type reactions, or discomfort, do not force them. Gut support should make your body calmer, not more irritated. There are also popular remedies that deserve a balanced word. Honey can soothe an irritated throat and may reduce the urge to cough temporarily. It is not a cure for reflux, sinus inflammation, or medication effects, and it should be used cautiously by people who need strict blood sugar control. Dairy does not create mucus out of nothing, but some people feel it makes existing mucus seem thicker. If you notice that pattern, a short trial reduction may help you learn your personal response. Apple cider vinegar is widely promoted online, but if silent reflux is involved, adding acid may make irritation worse. Be careful with that advice. Steam can loosen secretions for some people, but avoid very hot steam that can burn the airway or skin. Menthol may feel open and cooling, but it does not always reduce inflammation. Cough drops can soothe, but frequent use may hide the pattern without solving the cause. The goal is not to chase relief all day. The goal is to identify the drivers. Here's a simple way to think through your own case. If the mucus is worst in the morning, think reflux, overnight mouth breathing, dehydration, or nighttime post-nasal drip. If it stays all day, think chronic nasal inflammation, medication effects, hydration, and environmental irritation. If your voice is hoarse, think silent reflux or voice box irritation. If you recently began a blood pressure medication, check whether it is an ACE inhibitor. If your digestion, diet, stress, and sleep have been poor for months, consider the gut-airway connection as part of the larger picture. One more practical detail: avoid judging any single change after one night. Throat tissue can stay irritated even after the trigger is reduced. If reflux has been washing the voice box for months, or nasal drainage has been constant through an entire allergy season, the lining may need time to calm down. Improvement may show up first as fewer throat clears, less morning hoarseness, easier swallowing, or mucus that feels thinner. Those are meaningful signals, even if the symptom is not completely gone yet. Also pay attention to breathing through the mouth. A blocked nose, snoring, or possible sleep apnea can dry the throat overnight and make morning mucus feel worse. If you wake with dry mouth, headaches, daytime sleepiness, or your partner notices loud snoring or pauses in breathing, that deserves medical evaluation. Sometimes the throat problem is partly a sleep-breathing problem. You do not have to solve everything at once. Choose a 2-week experiment. Stop late eating. Elevate your sleep position. Start safe saline rinsing. Hydrate deliberately. Review medications. Add 1 gut-supportive food daily. Track morning mucus, daytime clearing, voice quality, and triggers. A written record is powerful because symptoms that feel random often become obvious when you see them on paper. And please remember this: medical care is not only for emergencies. If a symptom has persisted for weeks or months and affects your comfort, voice, sleep, eating, or confidence, it is reasonable to ask for help. A primary care doctor, ENT specialist, pharmacist, dentist, speech-language pathologist, allergist, or gastroenterologist may each play a role depending on the pattern. The right professional can examine the throat, review medications, evaluate reflux, assess nasal inflammation, and decide whether further testing is needed. The core message is simple. Persistent throat mucus is not a character flaw, not laziness, and not automatically a normal part of aging. It is a signal. In adults over 55, that signal often comes from 5 overlapping places: silent reflux reaching the throat, post-nasal drip from low-grade nasal or sinus inflammation, medication-related airway sensitivity, chronic mild dehydration, and gut-driven immune reactivity. Each cause has a different solution. That is why random remedies fail. You cannot fix reflux with only cough drops. You cannot fix medication irritation with more tea. You cannot fix thick mucus if you never address hydration. You cannot fix sinus drainage if the nasal passages stay inflamed. You cannot support an irritated airway long-term while ignoring the gut, sleep, stress, and diet patterns that shape inflammation. Use this information as a map, not a diagnosis. Your body is giving you data. Your job is to respond carefully, consistently, and intelligently. Start with the safest steps, watch your pattern, and bring the right questions to your healthcare team. This video is educational and should not replace personal medical advice. If your symptoms are severe, worsening, unusual, or connected with warning signs like bleeding, weight loss, swallowing difficulty, breathing problems, or a persistent voice change, please speak with a qualified healthcare professional. And if you take prescription medications, make changes only with your prescriber's guidance. If this helped you understand your throat mucus in a new way, share it with someone who keeps clearing their throat and thinks they just have to live with it. And before you leave, write one word in the comments: morning, all day, reflux, sinus, medication, hydration, or gut? Tell me which pattern sounds most like you. Your answer may help you pay closer attention to what your body has been trying to say.